has joined the global community today in observing World Meningitis Day, a day dedicated to raise awareness about the disease and promoting prevention efforts. The commemoration aims to ensure that individuals are informed about the risk of meningitis and seek early medical attention if they experience symptoms. Addressing the event, Director General of Administration at the Ministry of Health, Frank Raji, emphasized the importance of public health education in combating meningitis. He highlighted that providing accurate information about the disease is crucial for preventing outbreaks and ensuring the well-being of Ghanaians.
With around 1 in 6 people who get this type of meningitis, Northern Territories, that is Upper West, Northern, Northeast, Savannah, Oti, Bono East, and Upper East regions. That is within the meningitis belt of Africa, where the disease is recurrent and causes devastating effects on public health. According to the Ghana Health Service, more than 400 people die out of 4,561 meningitis cases reported between 2010 and 2015. And this renders meningitis a major public health challenge in Ghana. We recognize that providing public knowledge on health is central to disease prevention, and as such, we hold this special occasion in a high esteem. To this end, we are very happy to be partnering with the Concerned Health Education Project and their partners, the Confederation of Meningitis Organizations, to organize this very important event. Let me call upon all of us to continue to work together collectively to improve the health and well-being of all people living in Ghana.
The Chief Executive Officer of Concerned Health Education Project, Isaac Ampoma, urged all mothers to ensure that their children under the age of 5 receive the necessary vaccination.
Meningitis Day. World Meningitis Day normally is on 5th October every year. This year, because it fell on a Saturday, we decided to push it to today. The main goal is to ensure that we send some information to the Ghanaian public about meningitis, how meningitis come about and how we can prevent it, and also to discuss with the ministry about what we call the meningitis roadmap, which was outlined. And so key is to also discuss further and put together the expert committee to start working. And so our next line of action is to formalize the expert committee with the ministry as a national expert committee to be able to help us educate our people on meningitis and its debilitating effects. Indeed, vaccines works, and so we are encouraging all communities to make sure that all children under 5 also get vaccinated. And so meningitis is one of the sicknesses that affects the membrane of our brain, and once it does that, it can lead you into you lose your mind, you can be blind also, and it also affects the spine. And there are various genes, or what I call types. Some are fungi, some are viral, and some are bacteria. What is known commonly is the bacteria meningitis. And so, because it's very dangerous, we all need to sometimes single out some of the vaccinations our children are getting to understand why there's the need for this. And to us, we think it's a great partnership with the ministry for us to have this collaboration. World Meningitis Day normally happens on April, but this is the second time World Meningitis Day has been singled out. And so this is the second year we are having World Meningitis Day on the 5th of October globally. So next year will be the third phase of World Meningitis Day on the 5th of October. So the 2030 is a roadmap which is defeating meningitis by 2030. And this was agreed upon concertedly by the ministers of state at the World Health Assembly in 2020. And so we are in 4 years of the roadmap. It is very important for us to also engage policy so that policy begins to integrate the roadmap into national action plan.
As we commemorate the World Meningitis Day today, I think it is very important for us to drum home the importance of early detection. As we heard from the stories that was shared, it is really debilitating once you are unable to detect this particular disease condition early enough. So we need to encourage that people should be able to find out as early as possible whether they have come into contact with any form of bacteria that causes meningitis. As a Ministry of Health, within our mandate of policy formulation, it is also very important for us to look at our policies and to see how best we can integrate issues regarding meningitis. Most often, there are lots of programs that we implement as a sector that run vertically. So they run parallel to each other. There are lots of disease programs. We have a malaria elimination program, we have HIV control program, etc. I think it is about time that we think about how to integrate most of these programs for efficiency. In that we will not have a system that is only delivering vaccination for meningitis, but once we are using the same vehicle, how do we ride on the same vehicle to administer other forms of vaccines? Not to suggest it's not being done, but we need to strengthen the system to ensure that it's well integrated. I think we need to take very good care of ourselves. As we heard from the presentation, this disease condition is prevalent in the northern part of Ghana. And so once we have evidence that points to the fact that the disease is vaccine preventable, we need to ensure that we take the vaccination on time, because once you are vaccinated, you are assured of being preserved from contracting this disease. And so I will always push that. I'm happy the scientists have been able to develop a vaccine for this disease. And so I will push that people, especially those in the northern part of Ghana, should ensure that they are vaccinated and ensure that their children are also vaccinated to prevent the prevalence of meningitis in Ghana. What we can say for now is that it's very prevalent in the northern part of this country. But in terms of the prevalence rates, we are not able to share that for now. Once somebody gets infected with a particular disease condition, the health system has been programmed such that you can get access to care. So if you have an infection in relation to this virus or bacteria or fungus, I will advise that you go to your nearest health facility. There are specialists there, there are caregivers in these facilities who will be able to take good care of you. I think beyond the health system, we have also been made to realize the importance of family support. I think this is something that we need to highlight. It is not just about the health system, it is about who is providing care. And doctors provide care. The family members also can support in terms of giving care to people who have meningitis.
He further urged Ghanaians to take proactive steps to prevent and combat meningitis.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.